Hey, Dr. Clements, I want to remind you that a lot of the diseases we treat are caused by our lifestyles. And the best part about lifestyle diseases, if your lifestyle brought it to you, your lifestyle can take it away. So a lot of times type 2 diabetes is brought on by lifestyle. There are other things that can bring it on as well, like chronic steroid use or things of that nature. But I'm talking about if you're sedentary, if you're eating a poor nutritional diet, that can bring on type 2 diabetes. A lot of times high blood pressure can also be lifestyle. I think it's 1% that's truly essential hypertension, and that's a genetic thing. But again, we're talking about 1%. That's not a lot of people. So what your take home is, what do you have that you must do to reverse these problems? So it puts the power in your hands. Find out if you can and do it.
Frequently asked questions and myths about foot health. Common issues include plantar fasciitis, bunions, ingrown toenails, and fungal infections. Foot pain is not normal. Early care prevents serious problems. Some nerve damage cannot be cured, but treatment eases symptoms. Lastly, fungal toenails are treatable and new therapies restore healthy nails.
So why is it important to have a really good solid orthotic? Imagine having a tire that has a flimsy support. Every single thing above, or what we call everything that's in the superstructure, will be off balance. Why do we recommend custom-made orthotics? Because you want something that's custom for your arch. All of these orthotics, whether we're talking about a sport, whether we're talking about a dress, there is a solution for everybody. There are solutions for pediatrics or for kids as well. So my job is to help you diagnose the problem, and we want to treat the problem. Most of the time, though, we are treating the symptom instead of the problem. No. At Flat Shoals Foot and Ankle Center, we diagnose and treat the problem so that the symptoms will go away. So come on in to be evaluated for a custom-made orthotic arch support so that we can reestablish your foundation and get you back on your feet again. Hey, Dr. Clements here. So today I want to talk about venous disease. Venous is having to do with the vein. And I want to specifically talk about venous insufficiency ulcers and what can be done to prevent them or to treat them effectively. So the artery brings the blood away from the heart. The arteries bring the blood away from the heart, but the vein brings the blood back to the heart. So in order to go back to the heart, the veins are going uphill, or the blood is going uphill through the veins. The veins have valves. The valves keep the blood going up. Ordinarily, what should happen is the valves should close as the blood shoots up. With venous insufficiency, the valves become incompetent, meaning they don't close properly, so the blood shoots back down. So that's why we start to see those, the varicose veins, they start to dilate, they become wider because there's incompetence. So one of the treatments after this has been properly treated is compression hose, which is great. Walking is excellent as well. You want to treat the problem, not the symptom. So with varicose veins, you can develop venous insufficiency. Basically, the valves are not closing in the veins and the blood is pooling or going back down. Because remember, the blood has to go back up to the heart, so it's an uphill battle, right? So what will happen is as the fluid begins to pool in the legs or the lower extremity, it's going to increase the tension in the tissue, which will cause itching initially, like an itching burning sensation, but then it's going to cause ulcers at the site. And it's usually at the end around the ankle or in the leg is where we tend to see these venous insufficiency ulcers. So those need to be treated because they're very painful. In addition, there has to be proper compression, but we have to treat the wound as well. But in order for those to heal, we have to stop the excessive fluid that's building up. So it can be treated 100%, but we have to understand what's causing the problem, treat the problem, and not just the symptom. Hey, Dr. Clements. Today I want to talk about calluses and corns. on the feet, most people don't realize these are caused by imbalances. And what do I mean by an imbalance? So if the arch is too high or if the arch is too low is pronation, too high is supination, it will cause an imbalance. It'll create like a buckling. When the toes are buckling, you're either going to get a corn on top or a callus underneath the bottom. So corns or calluses represent an imbalance, a biomechanical instability. You must first treat that. Once you treat that, you can also cut or remove. When I say you, we would do it professionally. It's called debridement of the lesion. We would debride it down to bring it back to normal, but you have to balance. If you don't balance, it's like the tires. You got to balance, align, and rotate. And if you don't have a proper shoe with a proper arch support, the problem will keep coming back and it can become painful, which can cause either bursitis or what we call metatarsalgia.
The top 5 heel pain mistakes women make. Mistake 1. Wearing the wrong shoes. Mistake 2. Ignoring the pain. Mistake 3. Relying only on stretching. Mistake 4. Self-diagnosing and Googling. Mistake 5. Delaying professional help.
Hey, Dr. Clements here. So I want to read one of the plaques in my office, and it says 12 things to always remember. The first one is the past cannot be changed. Number 2, opinions don't define your reality. Number 3, everybody's journey is different. Number 4, things always get better with time. Number 5, judgments are confessions of character. Number 6, overthinking will lead to sadness. Number 7, happiness is found within. Number 8, positive thoughts create positive things. Number 9, smiles are contagious. Number 10, kindness is free. Number 11, we only fail if we quit. And number 12, what goes around comes around. Motivate yourself. Don't wait for anybody else to be your source of motivation. Go within. You have that power and authority. Make your day magical. Make your life magical. It's your choice.
Did you know? Each human foot contains 26 bones, 33 joints, more than 100 muscles, tendons, and ligaments, plus an intricate network of blood vessels and nerves.
Hey there, Dr. Clements again with your motivational minute. So I just want to remind you that every single process happening in your body right now is a miracle for somebody else. What do I mean by that? If you can get up and go urinate or pee, that's a miracle for somebody that is suffering with renal damage, right? Or may need dialysis. If you can have a good bowel movement, that's a miracle for some people with chronic constipation. So, pooping is actually a really big deal. So when your body is doing these things, thank it. Thank it. If you can walk and you have 2 feet, that's a miracle for somebody else. So a lot of times we don't see the everyday miracles that are happening in our lives. If you have somebody who loves you, or if you're able to love somebody, that's a miracle. So enjoy the small things because they're really big for others, okay? Hey, Dr. Clements again. So today I want to talk about PAD specifically. So PAD, some of the warning signs are pain in the leg that's brought on by walking, relieved by rest, pain in the leg that's due to very poor circulation. It could be leg or feet, a poorly healing wound in the lower extremity, the ankle, the legs, also the feet, injury to the lower limb or foot involving blood vessels or discoloration of the toes and feet. So these are some of the signs. Now, a lot of times when a patient is having pain, especially arterial pain, which is what we're talking about with PAD, which is peripheral arterial disease, we're talking about lack of oxygen. So if there's something that's decreasing the blood flow, that something could be plaque, it could be a blood clot, whatever the cause is, we've got to treat that root cause. If we don't treat the cause, then the symptoms, which is a pain, leads to gangrene and amputation. Hi, Dr. Clements again. So I want to talk to you today about gout. Gout is a type of arthritis, and it typically will impact the big toe joint of the lower extremity. It can impact any joint because it's a type of arthritis. It can impact the ankle, the knees. Typically in the upper extremity, we're going to see those big golf balls at the elbow. So it can impact the elbows. It can impact any of the joints. I've noticed mostly in this joint, but it can be any of them. So if you're having pain, it's usually excruciating pain that wakes you up in the morning, wakes you up at night, or keeps you from going to sleep. It might be a gouty attack. And again, gout has a liking, or what we call a predilection, for that big toe joint. And when I tell you, this is the only time grown men will come into my office in excruciating pain, crying sometimes, because that pain is intense. And what is happening, there are uric acids that the body is not releasing. So when protein is broken down, one of the end products is uric acid, right? So uric acid is usually, it just goes out through the urine, right? But if it's accumulating, meaning it's not going out, or too much is being broken down, or the end product of the uric acid is lodging in the joint, or the uric acid itself is lodging in the joint, then it's going to cause pain and inflammation. Icy hot is the best way to describe it, because these are the uric acid crystals, and the crystals are actually in the joint, and it creates a huge inflammatory, so the flaming response. So on average, we're going to see red hot swollen, and nothing, the bed sheets will hurt. It's very painful. Most patients will come in on crutches, or they can't put any weight on it. Very successful to treat it. I usually do a trigger point injection of an anesthetic, and I use two types of anesthesia, one that works immediately, one that's a little longer acting. And the purpose of the anesthesia is to wash the uric acid out of the joint. And when I do that, patients walk out, they hop in, literally they limp in, can't put any weight on it, and they will walk out. And it depends on the severity of their gouty flare-up. So sometimes if their pain level is a 10 out of 10, I'm going to put them in a soft cast, and I'm going to put them in a boot. And I will also prescribe anti-gout medication. Sometimes I do an anti-inflammatory as well. And we also recommend changes to the diet for a patient, because diet is part of it. Lifestyle is one of the number one things that will cause gouty flare-ups. And they call gout the rich man disease. And the reason for that is because it's the foods that are really rich. It's red wine, beer, it's steaks, it's shrimp, it's lobster, it's all the good stuff. Dehydration can also bring on gouty attacks as well. And most of the time when I see men, it's usually because they're outside mowing the lawn, they're drinking a beer, and they're dehydrated, they don't even know it. High cholesterol can also be something that can be part of what's going on to bring a patient in with a gouty flare-up. And then the other thing too is that there are several different treatments that can be done. So an acute flare-up is when the pain it just starts out of nowhere, versus chronic gout. So there are different types, so we have to know how to treat it appropriately. So with gout, you're either overproducing uric acid or you're under excreting, meaning you're not getting rid of it. So there are other ways that we can diagnose it as well. Very easy to diagnose, very easy to treat. It can be treated successfully. So don't sit around on gouty flare-ups, because gout can actually knock the kidneys out, leading to dialysis. So it's something that definitely needs to be treated successfully and made a priority, because not only can it impact one joint, Gout is also called a migratory arthritis, so it migrates from one joint to the other joint. So patients will come in and their initial pain may be in the left big toe, and then 2 weeks or 2 months later, it may be in the right ankle. So it will migrate from joint to joint. So our job, meaning my job and the patient's job, is to treat the problem, not the symptom only, but we got to treat the symptom because it's excruciating. So it's important to treat the overall cause so that we can decrease the recurrence of the symptoms, okay? Hopefully that helps, and may you never get a gouty flare-up because it is a wicked pain, but it's one that I love to treat because again, I've been doing this successfully for over 23 years, and it is such a joy when a patient, literally, they just come in, they're just hobbling, hardly can make it, they're miserable, and we will excuse them because most of the time they're just going to be like irritated and just not a pleasant person. But then when the pain level drops from 10 out of 10 to like a 4 or 5, and they get out of that psychotic pain cycle, then they can think again, and it's like you can see the burden lift. So it's actually a pleasure to treat these things. But again, always get a proper diagnosis so you can get a proper treatment. Okay, bye. Ooh-wee, I love treating gout. There is nothing like the satisfaction of a patient limping in and walking out. I tell you, I do this every day. 23 years I've been doing this, and oh my gosh, here comes another one. Gotta go. So if you have a red hot swollen foot or ankle, it might be a gouty flare-up. If the bed sheets hurt, it might be a gouty flare-up. If the pain moves from joint to joint, it might be a gouty flare-up. So do not sit on this.